Hey guys, welcome to my new podcast series, Your Health You Care. Hello everybody, this is Dr. Rakesh Mishra, General Physician. Welcome to my channel, Your Health You Care. Today I'm going to talk about nutrition deficiency in adults and elderly. Very commonly we get to see in the reports that individuals are deficient in B12 and D3. Most often either you are on the lower side of the normal value for B12 and D3, or in most cases you are actually deficient in B12 and D3. And there are other nutrients also which possibly are not taken up by the body as compared to the young adults or younger population. So I really wanted to talk about it for quite a while. Now I got this opportunity and time to share the information with you. So I would like to tell you or share this knowledge with you. The part of aging. As a human being, we age. Every day is new day, and there are certain age related changes that we tend to accept in our life. You are young and then you become big, and then you start to notice hair graying, then skin turgidity is low, and you notice hair fall, hair loss, then teeth loss, and then the strength, stamina reduce as you age. So these are the noticeable changes that you can see. Anybody can notice. Just looking at you can get an idea how old you could be. But and then you also want to take care of that, and you apply and take supplements for what you can see. What is unnoticed, or what has been or had been unnoticed so far, is the aging of the stomach, the gastrointestinal systems, liver, pancreas, and then intestines, as well as the kidneys. Nobody could see and say that, okay, this guy is aging, the liver is aging, but that is happening behind the scenes. What I mean to say is, for example, if you offer a plate of salad to an 18 years old and same plate of salad to a 70 years old individual, the amount of nutrients extracted from the 18-year-old's food compared to the 70 years old would be different, because the liver, the pancreas, the intestines, they are working so fine to extract the nutrients from the food. Let's say if 10% of the minerals are extracted from the 18 years old into the bloodstream, only 1 or 2% of the nutrients would be extracted from the 70 years old individual. On the average, this is a rough idea. So the 18-year-old might not be deficient in vitamins, essential vitamins and minerals, because metabolism is great. And for the 70 years old, the absorption itself is very low. Not much minerals are available for the blood. By the time the minerals meaning vitamins and electrolytes and nutrients that you eventually extract from what you eat, and then you complain that, hey, I'm eating the same food, I'm living the same lifestyle and all, but you're still deficient. How? So this is how it is happening. So what you should rather be doing is supplementing the minerals through synthetic form, through synthetic tablets, capsules, or whatever is available. In some cases, the injectables. Frequently, we administer vitamin D3 1 lakh international units intramuscularly, and then we give B12 500 mcgs and 1 mg if you are deficient. So these are very frequently done, and you should not worry too much about it, because it's just the way our gastrointestinal system is aging. If you are deficient, just go for it and have the supplementation done. I would not recommend that you do it yourself. You should be contacting your general physician, your doctor, your cardiologist, your whoever you are seeing for your regular health. um, why in some cases you do not get to know early about the nutrition deficiency? Because one reason is the nutrients level in the blood. They are kind of compensating for longer period. For example, the B12, the normal B12 range is very wide. Somebody who has B12 level of 200 250 is normal, and somebody who is 1200 1200 1300 is also normal. So most of the time you continue to stay in the lower side of the normal, and then you do not complain about the deficiency because it goes unnoticed. However, certain complaints like tingling sensations, weakness, easy fatigue, skin fragility, these complaints you might have, but it did not bother you to an extent that you would go and see a doctor for it, possibly under-reporting. So that is why you have the B12 deficiency is so common, or D3. D3 sunlight exposure is not as much in modern day life, um, and the metabolism. If you are a case of hypothyroidism, the calcium metabolism and D3, they go hand in hand. Osteoporosis, then again these things get along together, so it goes unnoticed in most cases. Now the other part is, should you supplement this with a tablet, capsule, syrup, or you should just get the intramuscular injections done? Well, that depends on the level, and it's up to the doctor's judgment what they want to do. In either ways, you are fine. They're very safe, so you can get it done the way you like. Regular, frequent monitoring is recommended, and regular supplementation with this, possibly the same brand or same module. If you're doing the injectables, do the injectables. If you're taking the syrup, you continue to take the syrup. If tablet, capsules, continue with that. Now the hard question here, can we supplement it with diet? What kind of food should I get to supplement vitamin B12 and D3? Well, unfortunately, like I mentioned earlier, the quantity of these essential minerals extracted from the diet and food may not be enough in some cases. So what is happening, what you are eating, you are metabolizing it, and then you are excreting through stools without contributing minerals to the blood for absorption to happen. So unfortunately you do not have much options. You can get in the sun, yeah, for D3, why not? Might not be enough, again, because it's not only the sun that helps with vitamin D and calcium. There are other factors in metabolism involved, and B12 again. There are researches suggest B12 absorption is next to nothing in stomach. There are some factors which are not available in the stomach, hyperacidity and whatnot. So I would rather strongly recommend get the supplementation done, and do not worry about it. It's just imagine you are having a plate of salad when you are getting a shot for it. um, what else can we talk about B12 and D3? Comorbidities, other medical conditions. Naturally, if you have multiple disease conditions, you are kind of immune compromised. If you have gastrointestinal diseases, if you have peptic ulcers, liver diseases, pancreatitis, gallstones, and biliary disease or kidney disease. So at the end of the day, all these machineries are required for the nutrition extraction only. So somebody who has these basic primary disease should be following up with their primary doctors and then get the supplementation done. If you have some kind of bleeding source, if you are on blood thinners, if there is blood in urine, if there's blood in stool, definitely need an attention from your doctor, because in cases of anemia, the nutrition deficiencies are extremely common. So see your doctor. All right, all the best, take care, and I'll see you again.